All right, so having gone over sort of this lymphatic circulation, where it collects from and how it winds up back in the blood system, now we're going to talk about the immune function of the lymphatic system and how all of this is handled and treated and filtered before it goes back into the cardiovascular system. Now, the thymus is, we've talked about it a little bit before in the endocrine system, but it's also got a really important role in the adaptive immune system. We'll talk about that more when we get to the T cells, but the thymus here is part of your lymphatic system and part of setting up this whole immune response that the lymphatic system is coordinating. So when we look at this lymphatic system, we can talk about different types of lymphoid tissue. So this is the actual immune tissue, and we're going to think a lot about sort of these lymph nodes. But first I want to talk about a couple of other types of lymphoid tissue. So there's diffuse lymphoid tissue, which is embedded in other tissue, often in epithelia. So you'll see this in mucous membranes, you'll see this in the skin, particularly important in your respiratory mucous membranes. So when you think about like a virus invading your respiratory mucous membranes, this is your body's first line of response. Then you have these lymphoid nodules. These lymphoid nodules, have a bunch of immune cells right there. They're sort of out in the tissues, but they're not as much, but they've got their own little centers. So it's its own little structure as opposed to just a little bit of tissue distributed through other tissues. So here's a lymphoid nodule again, and you can see this sort of very strong cluster of lymph cells. It's a little bit separated from this epithelium here, but it's still sort of out in the tissues. Your tonsils are lymphoid nodules, so they can also be very large. And because these are immune system structures, they can get infected. And sort of the tonsil infection is the one that you've maybe the most familiar with, the tonsillitis. Other nodules can get infected too, but tonsillitis is a particularly common one, where the tonsils will get infected and swollen. Obviously, people who have this commonly and severely, we sometimes remove those tonsils if they're particularly prone to these issues. Now, the other one, sort of the centerpiece here, is these lymph nodes. So the lymph nodes are a much more structured piece where all of the lymph that is coming back into the body is going to filter through some of these lymph nodes. So in a lymph node, you have afferent lymphatic vessels where lymph is going to come in, and then it's going to go through this whole node area. And this both acts as a physical filter in that it's small pores and its fluid can't flow through as easily, so stuff is just going to get caught in these physical pores, and it's going to expose the immune system to whatever is coming in. So both potentially killing things that are still alive that are coming in and alerting the immune system to the fact that there's a problem here. And we'll talk a lot more about that next week. But what's important here is that for fluid to get back into the body from the lymphatic system, it has to be filtered through these nodes. When something goes wrong with these nodes, that can lead to lymphedema. This is particularly common when nodes are removed. We'll talk more about why that would happen. But this can happen with lymph node infections and things like that. The lymph nodes get clogged, the lymph can't get back, and the area the lymph is coming from would get swollen. Here we're seeing this in the case of lymph node removal, which is often done with breast cancer patients. You'll have these armpit lymph nodes removed, these axillary nodes. So now it gets to this node, and what happens? I said their stuff gets filtered out, and it runs into these immune cells. So the first thing it's going to encounter here is dendritic cells. Dendritic cells are going to encounter an antigen, a signal from something that is not part of your body, and present that antigen to T cells. And if T cells react to that, they'll be activated and go out and start attacking whatever that thing is. And again, we're going to talk about that a lot more next week, but that's important because this sort of starts that whole immune response chain. So here's our lymph node that we're looking at here. So we've got blood vessels coming in to both supply the lymph node with everything it needs, and also to carry immune cells from the lymph node out into the blood. We have the lymphatic vessel carrying lymph in, which again is going to be filtered and exposed to those immune cells, and then also carrying it out so that it can go on to go into those trunks and then back to the blood plasma. So, all right, so we've been through this whole lymph node. Now we're leaving through the efferent lymphatic vessel. Great, but we talked about, that something can go wrong with those lymph nodes. Now, you've probably had a case where you were sick and the lymph nodes in your throat got swollen. This is really common with even a bad cold or, certainly with the flu, where a bad respiratory infection can cause the lymph nodes in your throat to get swollen. And that's because as the body is fighting the infection in those mucous membranes, in the respiratory mucous membranes there, all of that stuff that's collecting from those lymph ducts, from those lymphatic vessels, is now full of virus-infected cells and cell parts, as well as all of those immune cells that died fighting the infection. And all of that has to be processed. So your lymph node is filtering a lot, it's reacting to a lot, and it has a lot to deal with, and it starts swelling as part of this reaction. Sometimes it can also get infected itself, and that can also cause swelling as it's fighting the infection. Now, the other part, so I said we were going to talk about why you'd remove lymph nodes. So remember that anything that is in the lymph is going to come back to the lymph node, and it gets filtered out there. Now, if there is a tumor that is starting to metastasize, that means that some of the tumor cells are starting to be able to live elsewhere in the body and break off from the tumor. Then one of the first places they're going to wind up is in the lymph, because they'll be moving around in that fluid, they'll collect into the lymph, and then they wind up at a lymph node. Now, assuming that the immune cells don't successfully kill them, if it's adapted to grow somewhere else, it may start growing on that lymph node. And generally, when we treat cancer, we will look at what are called sentinel lymph nodes. We'll check a few lymph nodes to see if we see any tumor spread there. If we do, then we have to go through and check a bunch of them and remove a bunch of lymph nodes to avoid this then spreading any further, getting into the cardiovascular system and going everywhere throughout the body. So this is extremely common with breast cancer patients. There's a tumor removed from breast cancer, they'll check some of the lymph nodes, they'll often have to remove some. And if they remove a number of lymph nodes from that area, that people will have trouble with drainage, so that then the arm will become swollen with that lymphedema because those lymph nodes are gone, the lymph is being collected in the vessels, but then it can't go anywhere because it can't pass through those lymph nodes. This is generally primarily treated with compression sleeves that just put a little extra pressure, which both causes more fluid to go right back into the capillaries in the first place and pushes it more easily through the lymph nodes that do remain. Another part of the immune system is the spleen. So the spleen is divided into red pulp and white pulp. The red pulp, we've talked about a little bit before. It's involved in red blood cell production and the red blood cell cycle, removing those at the end. But white pulp here is what we're talking about right now, and this is involved in the immune system in creating and testing immune cells to make sure that you have immune cells that are working and not attacking your own body. So those are the parts of the immune system and the lymphatic system. Now, while mostly we're going to focus on the immune system next week, I want to sort of touch on what we're talking about here. So when we talk about the immune system, we're going to divide it into the innate immune system and the adaptive immune system. And what we're talking about in the lymphatic system is particularly this adaptive immune system. That's where the lymphatic system is focused. So when we'll come back to this, we'll talk some about the innate. We're going to talk a lot about this adaptive immunity. And that's how your body learns about an infection and is better prepared to defend it again. So that's the reason why vaccines work. You know, if you've been exposed to something, most of the time you've got immunity against it, and you're not going to get that exact same thing again. And we'll talk more next week about when that does and doesn't work and why there can be problems there. And the lymphatic immune cells are called lymphocytes, and we divide those into a few categories. Again, we're going to talk about this in a lot more detail next week. All right, so coming into the immune system, so those lymphocytes are produced in starting from this same stem cell that initially divides into the lymphoid stem cells and the blood stem cells. So at this point, we're looking at stuff that's created from the lymphoid stem cells. We talked before about stuff that was created from the blood stem cells. So lymphoid stem cells, you have some that hang out in the red bone marrow along with the blood-producing stem cells. And these produce B cells and natural killer cells. B cells are involved in this adaptive antibody-mediated immunity, and natural killer cells are exactly what they sound like. They don't need antibodies. They just go out and destroy things that aren't behaving properly. We'll talk more about that later. And then we have these lymphoid cells that migrate to the thymus. Remember that thymus that we talked about back at the beginning of this part? So they migrate to the thymus, and they start producing T cells, and T cells are involved in the adaptive immunity sort of from the other side of activating and preparing and going out and destroying, as opposed to creating these antibodies. So T cells go through thymic selection in the thymus. So this has both positive and negative selection. T cells go through positive selection, where we check to make sure that they do respond to the signal that says this is an antigen. So that they need to respond to what's called the MHC complex that presents the major histocompatibility complex that presents an antigen, says this is a thing, you should look at it. If they don't respond to that at all, then that's not helpful. We get rid of them. And then we have negative selection. Negative selection is making sure that they don't respond so strongly that they're going to attack all of our own body's cells. So negative selection, we're going to remove the ones that do attack, that do respond too strongly to our body's cells, positive selection, we're going to remove the ones that don't respond to, we're going to only keep the ones that do respond to something. And then all of this results in these T cells that will respond to antigen presenters, will not respond to self. So that's sort of our introduction of the lymphatic system. There is a case study that's starting in on the immune system. It is the sort of case study that in class we would do over the course of 2 days. So I'm giving you some extra time to work on it, but make sure you go and take a look at that. And if you have any questions, please come talk to me. Bye, everybody.